Good afternoon. This is Dr. Ollie Jones. I am the president of the Ohio Grandparent Kinship Care Coalition. And today we have a panel that's going to be discussing some issues around oral health in partnership with the Ohio Federation for Health and Equity and Social Justice Organization. Thank you for being here. At this time, I am going to pass my torch over to Siobhan Jones, who will do the introduction. Siobhan.
Thank you, Dr. Jones. As Dr. Jones stated, my name is Siobhan Jones. I am the current treasurer of OGKC. I would like to say good afternoon and welcome to our February Zoom meeting. I appreciate you all joining us. Without further ado, I am going to introduce our two speakers. I am going to start with Ms. Yavanka Hall. Ms. Yavanka Hall, MPA, is the executive director of the Northeast Ohio Black Health Coalition. She received a Master of Public Administration from Texas Southern University and a Bachelor of Arts from Notre Dame College. She is a proud graduate of the John Marshall High School in Cleveland, Ohio, and a 2019 inductee into the Alumni Hall of Fame. The Cleveland Plain Dealer recently named her the homegrown hero for her work addressing food insecurity. The 1974 murder of her mother, Yvonne Boston Hall, drastically changed her life. Her childhood promise to use her life to help others has led to the creation of cutting-edge programs and impacted thousands of people's lives. She is a mother, grandmother, and an activist deeply impassioned and involved in social justice activities locally and nationally, I apologize. She is an activist, leader, influencer, humanitarian, speaker, researcher, and a philanthropist, I apologize. I will move forward with Ms. Kamisha Chambers. She will follow speaking right after Mrs. Hall. Ms. Kamisha Chambers is a Cincinnati native. She earned her Bachelor's of Arts degree from Miami University, Oxford, Ohio, and her Master's of Science in Organizational Leadership from Mount St. Joseph University. Kamisha dedicates her life to the betterment of others, and her passion comes alive whenever she is able to serve others. Her initiatives have touched the lives of over 50,000 individuals combined. From 2013 to 2017, Kamisha sat at the table in Washington, D.C., shaping federal policy around HIV/AIDS. Currently, she is an associate pastor at the United Methodist Church in Community Development for All People in Columbus, Ohio. She is also in the Doctor of Ministry program at the United Theological Seminary with a focus on spiritual cultivation and trauma healing in places of worship and community settings. That is Ms. Kamisha Chambers and Ms. Yavanka Hall. Just one moment, ladies, before you all get started, I apologize, I did forget a piece. I would like to welcome as well, we have Ms. Lynn Stevens from the board on the call with us. We also have Ms. Barb Turpin, and who spoke first, Dr. Ollie Jones. I think that's all we have today. Yes, that's all we have today. So without further ado, Ms. Yavanka, would you be so pleasurable to start us off, please?
I think we should start with Kamisha.
Yeah, we actually have a presentation.
Oh, okay. All right,
okay.
ladies.
It is totally fine. It is totally fine.
Thank you.
I am going to try and pull this up. I don't see that lovely icon that we had talked about earlier. Oh, actually I do. I see it now. So hopefully you all will be able to see it here soon. Do you all see the icon or see the PowerPoint?
Yes.
Okay, thank you. So good morning to good afternoon, I should say, to everyone. I am so glad to be here with you. I've heard such amazing work that happens with the Ohio Grandparent Kinship Coalition. You all are doing some amazing work. You have some amazing leaders, and I'm so glad to be here. So as Siobhan stated, my name is Kamisha Chambers. I have the distinct honor of serving as the project director for the Ohio Federation for Health Equity and Social Justice, we are working with a beautiful plan to help those families that are in kinship care across the state of Ohio. And I am so excited to be working alongside with Ivanka Hall, who is a powerhouse in her own right in the city of Cleveland. I was about to put you in Columbus, Ivanka, in the city of Cleveland, doing such great work, who's the project manager on this effort, but doing great work in the city. So this grant is titled Advancing Equity Through Oral Health. And so what we recognized as a team is in Ohio, approximately 16,000 children are living in foster care. Another 228,000 children under 18 live with a grandparent or other relative, which is a 62% increase from a decade ago. And then the Ohio Department of Jobs and Family Services estimates up to 9% of all Ohio children are cared for by a family member rather than a biological parent, while Annie E. Casey Foundation puts this estimate at 4% nationwide. And so the opportunity that came, our president, Ron Browder, he and Lisa and other folks came together, Dr. Jones, and they sought out an opportunity that would be really beneficial for our state. And so through a grant from CareQuest, the Ohio Federation for Health Equity and Social Justice Research Division has secured a grant to strengthen the systems, services, and policies that support kinship care families, and in turn, increase their ability to positively impact the health and well-being of children in their care. And this grant explicitly focuses on addressing the unmet oral health needs of children in kinship care families. The rationale behind that, an Ohio Department of Health oral health screening of more than 3,000 third graders in 2017 to 2018 revealed the following, where nearly half of the children screened had history of tooth decay. Although 84% reported having a dental visit within the past year, on average, 20% had at least one untreated cavity. Also, lower income families, those covered by Medicaid, and uninsured children experienced more tooth decay and have a more urgent need to see the dentist because of pain and infection. However, these children are also those who are less likely to see the dentist on a regular basis. And then there's a disparity, right? There's an 11% disparity among Ohio's 32 Appalachian counties. Statistics show where 16% of children had at least one untreated cavity across the state, while 27% do in Appalachian counties. So our research methodologies that will be employed are surveys and focus groups, and Ivanka is going to elaborate more on that as she's doing some really diligent hard work in that space. What we're doing with the surveys, they're going to be on an online platform. They'll take approximately 20 to 25 minutes for completion, but that's dependent upon the number of children. So that's the minimum time frame that we're estimating that it will take. And then there's a $50 stipend that individuals will receive for completion of the surveys. We also are going to do focus groups. That'll be in an online platform as well. Group discussion that will take place during the focus groups will occur with the project manager and our project researcher, and an individual will receive $50 for participating in the focus groups. And like I said, I wanted to share this particular space right here with Ivanka so you can elaborate on this aspect of what's going on with the project, please.
So hopefully you all can hear me.
Mm-hmm.
So hopefully, one of the things that we do know around these unmet needs is when we talk about doing these assessments, which are the surveys that you all will be doing, about 53 questions. Again, as Kamisha said, it'll take about 20, 25 minutes, depending on your number of children. You'll receive $50. And then with the focus groups, we're looking to start those early on. So as soon as we start off with the assessment and release the survey, then the focus groups will be within the next couple of weeks. We'll have the first focus groups. We're trying to finish this at a steady clip. This is a lot faster than most research projects go. Most projects take, literally a couple of years. in order for them to go from a design to implementation, and then actually to get the reports back. So we're planning on doing this in a few months. The goal is to make sure that all of you are using your resources in order for you to send out the surveys to your partners, your partner agencies. And that I do know that Kamisha, if she's working with the larger agencies with us, that if you're sending anything out to any larger agencies, to make sure that we're listing them on the sheet so that all of us aren't sending things to the same agencies. That's a way for us to kind of keep track of what's going on, because if we don't get any follow-up from those agencies, then we can go back and reach out to the partners and say, you know what, if you have a contact with this agency that's better than a contact that I have, let's try to work to use it. The whole just behind this is being able to get the information, doing a report out around the systems, the services, and the policies, and the impact on people, because you're giving your own information about what's going on in your families. And so using that information to say, look, these are some unaddressed needs, unmet needs that need to have a higher priority, particularly when we have families that are kinship families, that are trying to get services for young people. And I guess what we can say is, think about the people who are in your network. So don't just say, oh, I have it for myself. And, think about your other friends, people that that are throughout the state that are also kinship care families or kinship care groups, that we can actually submit this out. We want to make sure that we're getting as much information as possible, and that we have as broad a range and zip code basis for us to look at this and say, we can kind of make some comparison data around what's going on in zip codes across the state. And then what are some of the things that are very much similar, and what are some of the differences? And so we hope that you will help us with that. There's strength in our numbers. And I think that for us, because we have, you all have such a strong group right here, that I don't see a problem with us being able to get the numbers that we need. So I appreciate the opportunity to talk about our end. Myself and Dr. Pugh are excited to get started. She's actually working on some stuff now. So I'm on 2 calls. So she's working on some things now. And then we'll kick it off. And so what'll happen is your payments will come through Lisa. So the stipends will come through the Ohio Federation for Health Equity and Social Justice. So you'll complete the surveys, and we'll let them know, and then you'll get your stipend. Anything else, Anisha?
I was muted. I'm sorry. Thank you. So that was really, really helpful, just to be able to share with you all as far as the surveys, the focus groups, what we're attempting to do. Ivanka touched on it as well. When you receive your survey link and you send it on and you complete it and you hit submit, it then comes into Ivanka and Dr. Pugh's inbox, and that information will then go to our finance team, and our finance team will be able to go ahead and issue out your $50. But there's some additional things that we did want to share why we really wanted to come into this space with you. There is such a huge significance and importance to all of the participants. Your responses help to increase access to oral health care for children. You're also helping to assist in identifying current barriers to receiving dental care for children. Additionally, you're helping to offer new insights into oral health care practices for families. Also assisting us with shedding light on potential additional disparities that we may not even be aware of that is happening across the state, as well as providing recommendations to lawmakers, decision makers, and the media. And you're giving insights on oral health practices of children in kinship care. And so you all are not even new to any of this, and you understand that there's a level of care that takes place with kinship care families, and there are some things that occur that folks who are in decision-making positions are not aware of. And so the better way to be able to begin to have some inroads and create systemic changes for families and for children is to receive and extract the information from those that are actually living the daily lives of this. And so you're really important to the success of this project. We definitely value what you have to say. We will take everything that an individual offers us in the surveys, we analyze it, we'll compile it, and it will, like Ivanka said, it'll be in a document that we'll be able to share with decision makers and lawmakers, and even the media, and shedding light on what's happening with you and the care of your loved ones and ways that folks can get involved. So your recommendations are what we're going to be presenting to folks. So you tell us what's going on, help us to shed light on what's going on, as well as giving us the recommendations. So we take that, compile it, and then we'll give it into the proper hands. There's a big push to try to really get into areas around school-based healthcare centers, and really working in that space, because even though there's a school healthcare-based center, the dental portion is really limited. And even in that limitation, there are a lot of students who don't get the opportunity to take up on that limited dental service. And so we want to know what those numbers look like and how we can help beef up those spaces as well. And so additionally, well, in addition to being able to share that information with lawmakers, we also have a plan, right, in trying to really beef up the school-based healthcare systems, and also wanting to learn if folks have health insurance, and if they do have health insurance, if they have any barriers to that health insurance. So that's the main gist of it all. If you want to enroll and participate in this research opportunity, your specific contact for OGKC is none other than the beautiful Barbara Turpin. Her email is listed, as well as her phone number here, but I'm sure you all have your system and how that information goes out. But wanted to share this with you with the hopes that we can get your voice heard and included in this process. We're excited about the work of what we're going to be doing in the state of Ohio around access to care for those kinship care families and the oral health needs of children. So thank you all so much for the opportunity.
Yeah, and I think that we should also say that for people who don't have access to the internet, that we do have a paper document for them. And so what will happen is, if you are receiving the paper assessment, you're going to have to put them in individual envelopes. So when they return them back to you, so that they can kind of they can remain anonymous, and that they're not sitting on your desk or out for other people to read. And so if you are getting them from us and you're giving them out when people return them to you, if you can put them in an envelope and seal it so that other people won't have it, and then Kamisha will figure out a way to get them back from them so that we can get all of that information entered. Because what we'll probably do is have you get them to me or Kamisha, and then we can scan them and get them over to Dr. Pugh, and then that way we can get the patient, get the parent, talking about the hospital, get the parent out their stipend.
Thank you for that.
So don't think we forgot you if you don't have a computer. I'm sure there are people like, I don't have the internet. We didn't forget you.
Well, thank you for that presentation. Before I go any further, I do want to recognize Darlene Robinson, who has joined the Ohio Grandparent Kinship Coalition as our secretary. So I do want to welcome her to her first monthly Zoom meeting. So welcome. Also want to remind everyone as well to get the word out about what we're doing around oral health care and the need. Tell your friends. We are on Facebook, we are on Instagram. So like us and pass it on to your set of people. So we really want to be as impactful as we can around the state of Ohio, because the greater we can impact, the stronger that we can be in providing services and information to kinship care providers. We know that most times kinship care provider sometimes are the last ones to get the information and get the support, but we are the voice for you, and we want you to really become more vocal in the needs, in your needs, and let us know, and again, get the word out. I don't know if Barb want to say anything, or Lynn, who is our co-vice president, want to say anything, but I do want to give you the opportunity.
Well, thanks, Dr. Jones. I do want to remind or make everybody aware of our next meeting in March. Is going to be March 23rd. Again, it's going to be another very informative meeting. I have a manager from Department of Job and Family Services who's going to be giving overview of information about supports for kinship caregivers. This would be the OWF, cash assistance, food stamps, childcare, other types of Medicaid or Medicaid, and other types of supports that Job and Family Services can provide to caregivers. She'll be talking about eligibility, as well as how some other programs might impact eligibility for children in these support programs, like receiving SSI or SSDI. So it's going to be very informative. We'll be sending out that information the beginning of the month, but if you're on the call today, you might want to just mark it down, March 23rd at 1 o'clock.
Anything else? Miss Darlene, did you want to say anything as coming on new? Want to just welcome you again.
Thank you, Dr. Jones. It's going to be an honor and a pleasure to be a part of something awesome.
Thank you. Well, if there isn't any other questions or comments, we're not going to hold you. We want to thank you for your time and for your participation. And again, please get the word out. This is a very important, impactful, and critical initiative that we're working with the Ohio Federation, and we know that we can make it happen. So thank you, and we'll see you next month. Have a great rest of the afternoon. Take care.
Thank you.